The Subcommittee on Workforce Protections will come to order. Welcome, everyone. I do note that a quorum is present. I note for the subcommittee that Mr. Courtney of Connecticut and Mr. Mervyn of Indiana are permitted to participate in the hearing today with the understanding that their questions will come only after all members of the subcommittee on both sides of the aisle who are present have had an opportunity to question the witnesses. The subcommittee is meeting today to hear testimony on strengthening the safety net for injured workers. This is an entirely remote hearing, and as such, the committee's hearing room is officially closed. All microphones will be kept muted as a general rule to avoid unnecessary background noise. If members and witnesses will be responsible for unmuting themselves when they're recognized to speak or when they wish to seek recognition. If a member or witness experiences technical difficulties during the hearing, please stay connected on the platform and make sure that you're muted and use your phone to immediately call the committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty or need to step away, another majority member is hereby authorized to assume the gavel in the chair's absence. In order to ensure that the committee's 5-minute rule is adhered to, staff will be keeping track of time using the committee's digital timer, which appears on its own thumbnail picture. Members and witnesses are asked to wrap up promptly when their time has expired. Pursuant to Committee Rule 8C, opening statements are limited to the chair and the ranking member. I recognize myself now for the purpose of making an opening statement. Good afternoon again. Today's hearing is an opportunity to discuss how to strengthen workers' compensation programs, which play an essential role in assisting workers disabled or fallen ill from their job. When Americans are hurt on the job, workers' compensation programs, whether at the federal or state level, provide a critical safety net. That is, if the system works as it is intended. And as we hear from Director Chris Godfrey, the Office of Workers' Compensation Programs, or the OWCP, is responsible for determining eligibility for federal workers' compensation for four groups of workers: federal workers, coal miners with black lung disease, longshore and harbor workers, and workers employed in the nuclear weapons complex. OWCP's mission is to ensure that these workers receive the benefits they deserve if are made ill or disabled from a covered workplace injury or illness. Today, we will evaluate three major challenges. Facing various workers' compensation programs, which are having significant consequences for workers, families, and taxpayers. First, workers made ill from toxic substances face nearly insurmountable burdens of proof. For example, firefighters are routinely exposed to hazards such as toxic smoke inhalation. As a result, they are at an increased risk of being diagnosed with lung cancer and other diseases compared to the general population. Laws in 48 states cover local and state firefighters for work-related diseases, but when federal firefighters apply for Federal Employees Compensation Act, or FECA, benefits, they're faced with a steep burden of proof. FECA needs to better meet the needs of federal firefighters. This pandemic has shown us again and again that too many state workers' compensation programs fail to support frontline workers who clocked in through the worst of the pandemic and contracted COVID-19. And while some states made workers' compensation automatic for essential workers such as nurses and law enforcement, many other groups, such as meat packer workers, were left in a wide swath of states with an impossible battle to prove that they contracted COVID at work. Thankfully, though, the American Rescue Plan Act, or through the American Rescue Plan Act, Congress eased the burden of proof for frontline federal workers by providing automatic eligibility for FICA benefits for those who contracted COVID and were in contact with patients or the public. However, maritime and shore workers covered under the Longshore and Harbor Workers Compensation Act still face a steep burden of proof to establish that their COVID-19 cases are work related. Um, the second challenge is that states are slashing workers' compensation benefits. Instead, um, instead of maintaining adequate benefit levels under state workers' compensation programs, many states are cutting benefits as part of a race to the bottom. This vicious cycle of cuts in benefits increasingly pushes workers with disabilities out of state workers' compensation coverage and shifts the cost of workplace injury to federal programs, including Medicare, Medicaid, and Social Security disability insurance. A 2015 Department of Labor report warned that because many workers with disabilities do not have access to adequate benefits, too many working people are at great risk of falling into poverty due to disabling workplace injuries. The third challenge is that The third challenge is that coal operators have taken advantage of weak federal oversight of a key part of the Black Lung program, which has resulted in a massive shift of their financial obligations for Black Lung benefits to taxpayers. As the Government Accountability Office has documented, OWCP failed over many years to ensure that coal companies, which are permitted to self insure for Black lung compensation, are setting aside sufficient collateral to pay Black lung benefits in the event of bankruptcy. As a result, coal operators have shifted an estimated $1 billion dollars of their Black lung liabilities into taxpayers and drove the Black Lung Disability Trust Fund even deeper into the red. As I previously noted in this subcommittee's February 2020 hearing, this fleecing of the trust fund and taxpayers has occurred under DOL's nose, despite the department's power to prevent it. The winners are the coal operators and their Wall Street creditors. The losers are the American taxpayers. I look forward to hearing about OWCP's work to address the deficiencies in the Black Lung program that it inherited. I also look forward to hearing about new initiatives that OWCP under the Biden administration, including plans to strengthen its oversight of state workers' compensation programs. Finally, this hearing will allow us to begin a conversation about legislative solutions and how they can help modernize worker compensation programs. First, the Federal Firefighters Fairness Act would provide that federal firefighters who are diagnosed with certain long-term illnesses would receive a presumption that their illness is deemed work-related under FICA. We need to reform FICA so that it's better positioned to help some of our nation's most heroic public servants. And second, the Longshore and Harbor Workers COVID-19 Compensation Act would establish a presumption that maritime workers who were diagnosed with COVID-19 received it at their place of work and ease eligibility for disability compensation and medical benefits. The House has passed this three times in the past 2 years, but it has withered and died in the Senate each time. Third, the Black Lung Benefits Improvement Act would help coal miners with disabilities access legal representation, improve access to evidence, adjust benefits for inflation, and reduce the backlog of claims. And finally, the Improving Access to Workers' Compensation for Injured Federal Workers Act would expand the number of qualified providers who can provide medical services under FICA. Thank you to our witnesses for joining us today. Is the ranking member here yet?
What the-
I'm sorry. Is the ranking member here? Is Mr. Keller here?
Chair Adams, I can only confirm that the ranking member's identity profile is still connected to the platform, but I cannot confirm activity from the profile.
Okay. Well, let me just move on then. Other members, without objection, who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5 p.m. on December 16, 2021. I think I'll have to recognize the ranking member when he gets here so we can move on. I'm going to introduce the witness now for the first panel. Congressman Salud Cabra has represented the 24th Congressional District in California since 2017. Representative Carbajal is testifying in support of his bill, H.R. 2499, the Federal Firefighters Fairness Act of 2021, which would improve the ability of federal firefighters to secure workers' compensation benefits under the Federal Employees Compensation Act, or FECA, if they develop certain illnesses associated with their work. We appreciate Congressman Carbajal for participating today. Look forward to your testimony, sir. Your written statement will appear in full in the hearing record, and you're asked to limit your oral presentation to a 5-minute summary. As the first panel is a member panel, there will be no questions of the witnesses, and we'll move immediately to the second panel at the conclusion of the testimony, unless, of course, the ranking member gets in, and we'll allow him to give his opening statement. The witness is aware of his responsibility to provide accurate information to this subcommittee, and therefore we will proceed with the testimony. Congressman Carbajal, you are recognized, sir, for 5 minutes.
Thank you, Chairwoman Adams, Ranking Member Keller, and members of the Workforce Protection Subcommittee. Thank you for the opportunity today to testify in support of my bipartisan legislation, H.R. 2499, the Federal Firefighters Fairness Act, that I have introduced with Representatives Bacon, Takano, and Fitzpatrick. This Congress marks the third time I have introduced this legislation since I was elected to represent the Central Coast of California in 2016. In all these years, this is the first time this critical bill has received a hearing, and for that, I want to thank and acknowledge the leadership of Chairwoman Adams, who is bringing it before members of the Workforce Protection Subcommittee for consideration. The Federal Firefighters Fairness Act ensures federal firefighters receive the same access to disability and retirement benefits as their peers who are state, county, and municipal firefighters, and who often fight the same exact fires. Like most firefighters in the United States, it would create the same presumption that federal firefighters who become disabled by serious diseases like certain cancers, lung disease, heart disease, and infectious diseases, contracted the illness on the job. Under the current federal law, federal firefighters are required to precisely identify an incident or exposure that caused the disease for it to be considered job-related. The burden of proving that one specific incident or exposure to a disease is extremely difficult for firefighters to meet because they work in so many environments and conditions. Fighting fires is hard and dangerous work. In one study conducted by Harvard University, scientists measured air contaminants levels at more than 200 structural fires. Benzene and chemical linked to many cancers was found in 181 out of 197 samples from fire scenes. Multiple studies have shown that there are over 100 chemicals that can be in smoke, showing just how difficult it can be for federal firefighters to prove an illness they contracted was caused by one specific chemical or incident. Most state, local, and municipal firefighters already benefit from something called a presumptive illness law. These laws link a particular occupation with certain diseases or conditions that have been connected to their work California was the first state to pass a firefighter presumption illness law in 1982. Today, 49 out of 50 states have presumptive illness laws that cover state and local firefighters. Sadly, not one of these laws cover federal firefighters. This is the gap and inequity that I hope to fix with the Bipartisan Federal Firefighters Fairness Act, which is overwhelmingly supported by my colleagues with 95 co-sponsors and supported by the International Association of Firefighters, IFFF, and the American Federation of Government Employees, AFGE. Madam Chair, I request to enter into the record a letter of support for HR 2499 from the International Association of Firefighters.
Order.
Last month, over 1,000 firefighters put their lives on the line to battle the LSL fire in my district on the Central Coast of California. I am so thankful for the federal, state, and local firefighters who work together to put out the blaze and keep our communities safe. All of them performed the same job. But again, a reminder, only federal fighters experience a disparity in their health benefits. It is not fair that federal firefighters are being denied access to benefits that their local counterparts receive, especially when they fight the same fires and expose themselves to the same risks. California experienced unprecedented wildfire seasons in 2020 and 2021, and scientists are projecting that wildfires will continue to increase in frequency and severity. Now more than ever, we need to do the right thing by our federal firefighters and pass this vital legislation. Our federal firefighters and their families cannot continue to sacrifice and put themselves in harm's way to protect us all, only to be denied health care benefits simply because they cannot prove a work-related illness was linked to one chemical or incident. Firefighters of all types are heroes and deserve the same respect and benefits for the hard and necessary job they perform. It is high time to pass a presumptive illness law for our federal firefighters and not continue to treat them as second-class firefighters. We must push this measure across the finish line. Thank you again for the opportunity to speak on my legislation, HR 2499, the Federal Firefighters Fairness Act. I yield back, Madam Chair.
Thank you, Congressman Harbor, for your testimony on this important issue. This concludes this first panel, and I'm going to request that the witnesses on the second panel, if you would prepare to turn your cameras on. But before I do that, let me recognize the ranking member who is with us for his opening statement. So Ranking Member Keller, you are now recognized, sir.
Thank you, Madam Chairwoman. The hearing today takes a kitchen sink, spaghetti on the wall approach to a wide variety of federal workers' compensation programs, including legislation which purports to solve shortcomings in many of them. Unfortunately, many of the proposals we will discuss today only add additional layers and expense to already bloated and mismanaged federal programs. For instance, the Black Lung Disability Trust Fund has been plagued by financial difficulties since it began over 40 years ago. It has been in debt since it was created. Many of the trust fund's problems stem from the Department of Labor's decades-long failure to provide proper oversight or enforcement in addition to interest accumulation on its debt. As a result, the trust fund's expenditures regularly exceed its revenue. Because of this funding shortfall, the trust fund borrows from the Department of Treasury's general fund every year. In 2021, the trust fund borrowed approximately $2.3 billion to cover its cost. As of September of 2021, total liabilities for the trust fund exceeded its assets by over $6 billion. This is both shameful and unsustainable. The Trump administration made great strides to correct the trust fund's flaws and to revamp the self-insurance process for coal mine operators. The Biden administration should restrain itself from dismissing President Trump's reforms out of hand and put the well-being of the program above politics. GAO's testimony today states that Department of Labor officials could not describe any anticipated changes to coal operators' self-insurance going forward. And Mr. Godfrey's testimony confirms that any reforms to the Black Lung program will be made public months in the future. This is unacceptable. In the meantime, Democrats propose papering over inept oversight of federal workers' compensation programs with big government solutions. Democrats continually turn a blind eye to the real problems plaguing these programs. Instead of working on bipartisan legislation, like this committee has historically done, Democrats are demanding more layers of bureaucratic red tape, wasteful spending, and increased control over job creators. The FECA program is an example of potential bipartisan agreement. In the 112th Congress, the committee took steps on a bipartisan basis to reform FECA by introducing legislation that would modernize the FECA program, improve its integrity, and enhance its efficiency. We should revisit common sense bipartisan reforms instead of pushing workers into broken and bloated programs. Unfortunately, today, many of my Democrat colleagues and the Department of Labor are advancing for legislative changes that will not, advocating for legislative changes that will not improve the critical programs federal injured workers rely upon. Creating presumptions of eligibility under the Longshore program and FECA will only further strain department resources, increase backlogs, and cause the department to shift personnel and dollars from other critical programs, like programs to fight opioid misuse, an issue which has plagued communities in central and northeastern Pennsylvania, as well as across all of America. I would like to urge the Office of Workers' Compensation Programs, or OWCP, to focus on reforming the programs they currently oversee by addressing recommendations made by the Government Accountability Office and the Office of Inspector General. The Office of Inspector General's annual report outlines several significant concerns within OWCP. The department should address these recommendations before moving forward with radical proposals to monitor state workers' compensation programs or haphazardly broadening benefit eligibility. I hope that this committee can return to bipartisan discussions to ensure these programs are efficient, effective, and making good use of taxpayers' dollars while protecting the people they are designed to protect. I would like to thank our witnesses for being here today, and I look forward to hearing your testimony. I yield back.
Thank you to the ranking member. Thank you very much for your statement. We're going to move now to the second panel. I want to make a request that the witnesses on this panel, please turn your cameras on at this time. Mute your microphones unless you are speaking. I will now introduce the witnesses for the second panel. Our first witness is Christopher Godfrey, Director of the U.S. Department of Labor's Office of Workers' Compensation Programs. Mr. Godfrey is responsible for overseeing the department's work, processing tens of thousands of claims from federal employees, nuclear weapons, complex workers, coal miners, maritime workers, and others, and the payment of billions of dollars in benefits. He previously served as the chief judge and chairman of the Employees Compensation Appeals Board. And before that, he served 8 years as Iowa's Workers' Compensation Commissioner. Our second witness is Thomas Costa, who serves as Director of Education, Workforce, and Income Security at the U.S. Department Accountability Office. With degrees from George Washington University and the University of Connecticut, Mr. Costa has been with GAO since 2005, and his work has included labor-related issues as well as State Department management and diplomatic security. To our witnesses, thank you so much for participating today. We look forward to your testimony. Your written statement will appear in full in the hearing record, and you're asked to limit your oral presentation to a 5-minute summary. After your presentation, we will move to member questions. The witnesses are aware of their responsibility to provide accurate information to the subcommittee, and therefore we will proceed with your testimony. I will first recognize Mr. Godfrey. Mr. Godfrey, you are recognized for 5 minutes, sir.
Thank you. Chair Adams, Ranking Member Keller, and members of the Workforce Protection Subcommittee, and Mr. Costa and other GAO participants, I'm grateful for the opportunity to speak with you today about strengthening the safety net for injured workers. Every day, the Office of Workers' Compensation Programs touches the lives of thousands of workers and families, providing a safety net in their times of need. The FECA, Longshore, Black Lung, and Energy programs have the unifying mission to protect the interests of workers who become injured or ill on the job, ensuring fair claim adjudication and prompt entitlement payments. I'm incredibly proud of what OWCP has accomplished during the first 10 months of this administration, and I want to share with you a few of our noteworthy accomplishments. First, following the attack on the U.S. Capitol building on January 6th, the FECA program established a special unit to ensure prompt and consistent handling of claims filed by federal law enforcement officers and other first responders who suffered traumatic injuries on that date. After President Biden signed the American Rescue Plan Act into law in March, OWCP implemented its provisions, making it easier for federal workers to file COVID-related workers' compensation claims under FECA. To date, OWCP has processed over 22,000 COVID claims from federal workers, and less than 1% of those claims remain unadjudicated. Also, with ARPA funding, OWCP hired over 170 new claims examiners, strengthening our historically neglected FECA workforce. OWCP has adapted to the pandemic by transitioning to a 100% telework posture. Our energy program has expanded telehealth options, digitized paper case files, and offered online outreach and educational events. Our Black Lung program has moved to a fully digital claims environment and eliminated millions of pages of paper files. OWCP is currently focused on initiatives to strengthen our service delivery for injured workers. In the FECA program, a pharmacy benefits management service known as a PBM will lead to lower prescription costs and create additional drug safety controls, including increased opioid safeguards, which are so important. We plan during this fiscal year to also move forward with the PBM in our Black Lung and Energy programs. We're also working to combine medical bill processing with physician network services to increase the number of physicians available to provide treatment to our claimants. In line with President Biden's emphasis on diversity, equity, inclusion, and accessibility, OWCP has taken several steps, such as outreach to underserved communities like the Navajo Nation, and updated our recruitment efforts to obtain a more diverse talent pool for job openings. Other accomplishments that we have made are noted in my written testimony. OWCP has also sought to improve the handling of claims for federal firefighters by working with NIOSH to create an improved process to address the unique challenges of developing those delayed onset occupational illness claims. Recently, in collaboration with the Departments of Defense, State, and the White House National Security Council, OWCP developed guidance on processing claims for anomalous health incidents. Finally, OWCP has explored the possibility of recommencing publication of its annual report on workers' compensation systems, and those would be consistent with DOL reports from 1980 through 2004. Turning now to GAO's 2020 report on Black Lung self-insurance programs, I want to address two key recommendations concerning OWCP's oversight responsibilities. First, they recommend that OWCP should develop and implement procedures for self-insurance renewals. And second, that OWCP should develop an appeals process for self-insured coal mine operators to utilize when they disagree with determinations concerning authorization or the amount of collateralization required to be self-insured. Based on these recommendations, over the past 10 months, OWCP has performed a comprehensive review of the existing self-insurance structure and the impact of the changes made to self-insurance process by the previous administration. That detailed review is complete, and the self-insurance has been included on the DOL regulatory agenda, and we plan to move forward with an NPRM in the coming months. 7 coal mine operators have appealed self-insurance authorization decisions made by OWCP during the previous administration. We're currently in the process of reviewing those appeals. Bottom line is this: OWCP is committed to doing everything that we can to protect the trust fund against further liabilities from undersecured self-insured operators through a fair, transparent, and efficient process. In the past 10 months, OWCP has handled emerging issues such as COVID-19 and the Capitol attack, and made progress on initiatives including the PBM and equity efforts, while still charting a path towards resolution of longstanding concerns such as self-insurance and the Black Lung Disability Trust Fund. I'm honored to be able to lead OWCP as we tackle these challenges, and thank you again for the opportunity to testify today to discuss how OWCP is working to strengthen the safety net for injured and ill workers. I look forward to your questions. Thank you.
And thank you, Mr. Godfrey. We'll now hear from Mr. Costa. Mr. Costa, you are recognized for 5 minutes.
Thank you, Chairwoman Adams, Ranking Member Keller, Chairman Scott, Ranking Member Fox, and members of the subcommittee. I'm pleased to be here today to discuss 1, the serious financial challenges facing the Black Lung Disability Trust Fund; 2, GAO's prior recommendations concerning the Department of Labor's limited oversight of coal mine operator self-insurance; and 3, updated actions DOL has taken to improve oversight of self-insurance and implement our recommendations. My testimony is based primarily on prior GAO reports and updated information provided by DOL in November. The Black Lung Benefits Program provides assistance to coal miners who are disabled due to black lung disease. Over 24,000 beneficiaries received benefits in fiscal year 2021. Black lung benefits are generally paid by liable coal mine operators. Operators may purchase commercial insurance or self-insure to cover benefits. The federal government's Black Lung Disability Trust Fund pays when no responsible mine operator can be identified or the liable mine operator doesn't pay, such as through a bankruptcy. This brings me to my 3 discussion points. First, the trust fund faces serious financial challenges with expenditures consistently exceeding revenue, especially its debt and interest payments. Consequently, the trust fund has borrowed from the Treasury almost every year since 1979. In fiscal year 2021, the trust fund had to borrow $2.3 billion to cover its expenses, and based on our previous projections, the trust fund's debt could exceed $15 billion by 2050. The fund's primary source of revenue is a coal tax that has changed little since 1986 and is set to decline next year. Compounding these challenges, coal production has declined, reducing revenue, and additional coal operator bankruptcies have further strained the trust fund. We previously reported that bankruptcies between 2014 and 2016 of self-insured operators led to the transfer of $865 million in benefit responsibility to the trust fund. Since then, at least 5 more self-insured operators have filed for bankruptcy. Making things worse, there has been a resurgence in the number of miners contracting the most severe form of black lung, likely leading to increased future liabilities. On to my second point. In response to DOL's limited oversight of coal mine operator insurance, we recommended that DOL develop procedures for self-insurance renewal that clarify how long an operator is authorized to self-insure, as well as when self-insurance authority would not be renewed, and that they develop procedures for self-insured operator appeals. And now for my third point. When we testified in February 2020, we noted DOL had begun implementing a new process for self-insurance that, if implemented effectively, might have helped address past deficiencies in our recommendations. That didn't happen. Instead, DOL suspended and then rescinded its efforts. In February 2020, DOL sent letters to 14 self-insured operators authorizing most to self-insure for 1 year if they provided about $251 million in total collateral. 7 complied. 5 others appealed and did not provide the collateral. As a result, DOL didn't secure about $186 million in collateral from those operators. DOL told the remaining 2 operators, both of whom appealed, that they no longer qualified to self-insure and must obtain commercial insurance. In addition to the 14 operators DOL contacted, there are 3 additional self-insured operators. DOL didn't reassess the collateral secured by 1 because DOL had done so in 2019. The other 2, however, didn't provide actuarial estimates that DOL could use to assess the proper amount of collateral. DOL said their ability to resolve appeals was hindered by the COVID-19 pandemic, as they and coal operators adjusted to different working conditions and experienced challenges in processing documentation. As a result, DOL suspended its review of operator appeals. In December 2020, after a 5-year effort, DOL issued a preliminary bulletin with updated guidelines for coal operator self-insurance. However, in February, DOL rescinded that bulletin pending review. As of November, DOL had not taken action on the pending appeals or reauthorized operators to continue self-insuring after their approvals to do so had expired. However, as Director Godfrey just noted, DOL noted they recently completed their review of the guidelines and expect to go through a rulemaking process in the coming months. It is unclear how long this process might take. In summary, the future financial situation facing the trust fund has worsened over the last 2 years, during which DOL did little to forestall this decline. While DOL collected some additional collateral from several self-insured operators, half the operators haven't secured the support they will owe their disabled minors. Given the dire situation facing the trust fund, we reiterate the need for DOL to take action and address our previous recommendations. This completes my prepared statement. I look forward to your questions.
Thank you, sir. Thank you very much. Thank you to both of our witnesses. Under Rule 9A, we'll now question the witnesses of this panel under the 5-minute rule. I'm going to recognize myself as chair for 5 minutes. Nearly 2 years ago, the GAO testified before the subcommittee that nearly $1 billion in liabilities were transferred to the Black Lung Disability Trust Fund by bankrupt coal operators that had been allowed by DOL to self-insure with only a minuscule amount of collateral. It happened because DOL failed to hold these operators accountable. Coinciding with the hearing in February of 2020, DOL wrote more than a dozen operators advising that they must post nearly $250 million in collateral in order to continue self-insuring. 7 have appealed, but almost 2 years later, your agency has not ruled on those appeals. These operators still have not posted that increased collateral, leaving taxpayers at risk. So, Mr. Godfrey, how long does the DOL expect the rulemaking process regarding self-insurance to take? Mr. Godfrey.
Thank you for that question. Where we are at in terms of dealing with the self-insurance review is that we're at a place where we have studied this issue. We've worked through the GAO studies, not only from 2020, but also the 2018 GAO study that dealt with the concerns to the levels of debt within the Black Lung self-insurance, within the Black Lung Disability Trust Fund. And what we have done is found that there are ways that we can work on the minimum improvements that were made during the last administration, which did, in some respects, address those changes that were recommended through the GAO. I think that we can do better. I think we can do it more efficiently, and we can do it through a regulation. A regulation will be one that will allow for public comment, and that as we go forward, we will still be working on a dual track with the prior work of the prior administration.
Okay, so do you have a time frame? Do you have a schedule? But that was really my question. And let me just move. So you didn't sound like you had one of those. That you don't have a time frame. There's some things you said you needed to do. But there's not. Let me move on. Mr. Godfrey, what is the magnitude of costs shifted into federal safety net programs because of insufficient state workers' compensation programs?
Sure, and if I could first clarify, the notice of proposed rulemaking is on our regulatory agenda. We have begun work on that process, and it's simply the time it takes to promulgate that rule, receive comment, and then go into final rule. In terms of the second question that you've asked, it is difficult to quantify the amount of costs that have been shifted to various programs from reductions in state level workers' compensation systems. That is difficult for us within OWCP to fully understand. What we do see is there are areas like the Black Lung program within OWCP that can be impacted. We also see the VA, Medicare, Social Security as also being impacted. I think one of the things that we can see is when we look at the 19 essential functions from the 1972 Commission, if we can go back to doing an annual state report as they did from 1980 to 2004, I think we can start to actualize what that transfer is.
Okay, let me get one more question in here. So should the federal government set minimum standards so that the states will stop shifting costs onto the taxpayer?
The Department of Labor is not taking a position on whether or not there should be minimum standards. I
Okay.
think what we can look, though, is at the 19 essential recommendations from the 1972 Commission.
Okay, quickly, Mr. Costa, does this approach leave taxpayers at risk in the event of bankruptcy?
Yes, Madam Chair, it does. As long as the department is not securing the collateral that it's requested and it's not managing the appeals process, if another self-insured coal operator goes bankrupt, there's a good likelihood that some of that liability will be transferred to the Black Lung Disability Trust Fund.
Okay, I've only got like 15 seconds. So how many companies right now are still self-insuring without current authorization by DOL? Do you know?
16.
Okay, all right, great. Well, I'm gonna adhere to what we're asking everybody to do, and I'm gonna yield back and my time, and I'm gonna now recognize the ranking member for 5 minutes for his questions. Keller?
Yes. Thank you, Madam Chair. Mr. Costa, in February of 2020, Julia Harthway, who was at that time the director of the Office of Workers' Compensation Programs, testified before this committee on the actions that OWCP was already taking to address shortcomings in the Black Lung Benefits Program identified by the GAO, consistent with your February 2020 recommendations. OWCP subsequently published a bulletin on December 7th, 2020, outlining new self-insurance process guidelines. In your opinion, did the Trump administration take meaningful action to implement GAO's recommendations, and were these steps consistent with those recommendations?
Thank you, Ranking Member Keller. Yes, it appeared as though the bulletin guidelines were going to be addressing our recommendations. It remained to be seen if they had been implemented, whether or not they would have fully addressed those recommendations. And that is one step that needs to occur in order to help ensure the solvency of the trust fund.
So you say if they would have been implemented, so they weren't implemented by the Trump administration, or was that because of actions on the Biden administration when they withdrew from the Trump administration's bulletin?
So the guidelines were issued in December at the very end of the Trump administration, and they were rescinded by the Biden administration in February of this year.
Was there any rationale from the Biden administration why they rescinded those?
I'd have to defer to Director Godfrey for that, sir.
Director Godfrey, are you aware of the rationale behind?
Yes, I am. The rationale was in February of 2020, when Director Harthway testified before the subcommittee, it was noted that it would be within 90 days that the appeals would be handled. That did not occur. When the bulletin was issued in either December or January of 2021, that had been over 11 months since it was said that it would be 90 days to resolve that matter. It was in that last few weeks of the administration that it was finally published as a bulletin. I felt that as I came in, and because of the changes in the executive order relating to the use of bulletins, that it would be best to take under consideration what the prior administration has done, but not be bound by it in an ongoing manner to see if we could find efficiencies and ways to do it better. Obviously, if it took 11 months to perform those appeals under the last administration, we need to find efficiencies and ways to do it much, much quicker.
I can understand finding efficiency and ways to do it much more quickly, but delaying these things that were recommended be done is certainly not helping the people that are going to benefit from making sure that their system is solvent. And I think it's quite frankly irresponsible to do that without a plan. So I guess I would just look at the rest of the things. And Mr. Costa, what actions, if any, has the Biden administration taken to implement GAO's recommendations and to increase solvency of the Black Lung Trust Fund?
Sir, as I testified, the current administration has been studying what the previous administration recommended, but as far as I know, there has not been any concrete steps taken thus far. Director Godfrey just testified that they finished their review and are going to be moving forward in the coming months with some new measures. But I'm not sure how those measures will impact the trust fund at this point.
But we had recommendations that the Trump administration had said would help. Your recommendations that the Trump administration had implemented and would have made this fund more solvent, correct? Under your estimation.
Yes, sir. We believe that if our recommendations had been implemented, that it would have helped the trust fund. It's only one of the major things that needs to be done to address the trust fund solvency issues, however.
Yeah, but understanding that was done in February, which was almost 10 months ago.
Yes, sir.
Meaning that we lost all that time. And that puts, in your opinion, losing that time where we could have had work towards solvency, does that put the trust fund more at risk?
Yes.
Than it would have been? Okay. Mr. Godfrey, GAO testified today that the changes made by the Trump administration to reform the Black Lung program and overhaul DOL's oversight of self-insured coal mine operators were a positive step towards implementing the GAO's 2020 recommendations and improving the solvency of the Black Lung. We just heard about that, and the Disability Trust Fund. Of course, I know we've talked about it. We withdrew from those. Can you tell us, what's going to happen? We put these on hold for whatever reason, and I'm not getting that, but and we don't really, just because it took that many months doesn't mean we shouldn't be getting the benefit from it. But what do you think, or what reforms do you think are going to happen? They're going to make up the difference of this. Are you going to do anything differently, or what did you find?
Thank you for that question. I would note that although there was letters that went out in February of 2020, for the remainder of the administration, there was no action taken.
The gentleman's time is up.
Well, I would just like to say, we can try and place blame wherever we want. The point was there was action taken. And this administration, by not taking advantage of being able to make this fund more solvent, can try and make all the excuses they want, but they've been in charge now for 10 months, and they need to do something if they want to be responsible to fixing this for the people that rely on these benefits. So I would suggest that this committee hold oversight that we should hold and make sure that we protect the people.
Your time is up, sir. We are way over time on this, sir. We have to move on. Thank you. We're going to hear now from the gentleman from Virginia, the chair of the Ed and Labor Committee, Mr. Scott. You are recognized for 5 minutes, sir.
Thank you, Madam Chair, and I apologize for being in the phone booth. We're back and forth from votes, and I have a meeting coming up fairly soon. Mr. Godfrey, in your written testimony, you mentioned challenges with claims by firefighters. Does Mr. Carvajal's bill address those challenges?
Yes, thank you for that question. That piece of legislation is a positive piece of legislation that does address issues related to federal firefighters, especially with those very difficult to prove long-term occupational disease claims due to exposures. Prior to that legislation moving forward, I've already taken steps, however, to work directly with NIOSH to make sure that we can work to get those types of claims handled in a very expeditious and a very fair and consistent manner. We've reached out to the firefighter unions. We've done significant discussions with NIOSH, and I believe that with the special claims handling unit that we're going to put in place, that we will have a system that will help those individuals that have federal firefighter claims that are based on occupational exposures have a much better outcome in terms of those cases, because we're going to be assisting with the development of that medical evidence and the factual evidence, but also working with NIOSH to make sure that we're continuing to identify each and every type of illness that would fall within this type of definition.
Thank you. And we had the presumption for federal and postal workers out of fairness, should longshoremen be entitled to the same kind of presumption that we extended to those other workers?
I'm unaware that the administration has taken a position on that. I do know that we did provide technical assistance during the Rescue Plan Act on that specific provision.
Well, if you could get back to us on extending this same presumption to longshore and harbor workers, we'd appreciate it. Are you familiar with the disgraceful fraud that was going on in the FICA program with compounded drugs?
Yes, sir.
Have you, there's massive fraud going on. Have you fixed that?
It is fixed. At this time, we do not have expenditures to any specific amount for compounded drugs. And with movement onto the PBM, we'll have even additional safeguards to make sure that compounded drugs are not compensated through the system.
Did anybody go to jail behind that?
I am unaware of that fact. We can certainly get back to you with facts regarding prosecutions.
Okay, thank you. Do you support the long-term extension of the black lung excise tax of $1.10 per ton underground and 55 cents per ton surface coal?
DOL does believe that it's critical for that to be maintained.
Thank you. Are you aware of the cost of the extended presumption under the FICA program? What CBO, it's my understanding CBO scored that provision at about $103 million. You know what it's cost so far?
May I ask, are you referring to the COVID-related claims under FICA?
Yes.
Okay, the numbers for the FICA COVID claims at the current time are approximately $24.3 million out of the 22,000 accepted claims.
And CBO estimated 103. Do you think you have clearly sufficient funds to pay those, continue paying those claims, including so-called long COVID claims that may extend many years?
At this time, I do believe we have sufficient funding. We are working very carefully on the issue of long COVID and working within the agency here at DOL to make sure that you know, we're identifying long COVID where it exists and how we can address it together.
Thank you. Madam Chair, thank you very much, and I yield back.
Thank you, Chairman Scott. I want to recognize now the gentlelady from North Carolina, our ranking member of the Ed and Labor Committee, Representative Fox, you recognize.
Thank you, Madam Chair. I need to register my strong protest on how this hearing was begun. It's deeply inappropriate that this hearing started during votes while only 2 members were present and no members of the minority. We had essentially no members present for testimony, all because most members of the committee were doing their jobs and voting on the floor. We need to return to in-person committee proceedings. Mr. Godfrey, in your testimony, you state that OWCP is exploring the possibility of publishing an annual report on state workers' compensation programs and increasing oversight of state workers' compensation programs. The Department of Labor does not have the authority to monitor state workers' compensation programs, which were established more than 100 years ago under state constitutions and legislation, independent from federal programs. This unilateral move by OWCP would be a significant departure from longstanding policy. Under what authority do you plan to do this? What is the purpose of this federal report? And does the department believe it can better manage state programs, which are currently managed by an array of regulatory agencies at the state level? And that OWCP programs are currently themselves in need of reform and suffering from mismanagement. And I need very quick, pertinent, cogent answers.
Thank you. And if I miss any of the responses, please follow up to let me know which ones. First of all, as a former state work comp commissioner, I understand the independence of state work comp systems. In terms of the work that is going to be done, those reports had been compiled from 1980 through 2004. We would use the same authorization. The information within those
And
reports,
we'd like you to give us that authorization in writing after this hearing.
I will do that. Thank you. In terms of the actual documentation within the reports, it would be limited to what was done previously, which is looking at the 19 essential recommendations from the Bipartisan 1972 National Commission report, as well as looking at annual changes in state law. I know that many of those pieces of documentation already exist from other areas, but simply are under, for pay type of reports. So we'd like to do that as we have done in the past.
This administration's looking backward again. Mr. Godfrey, please describe the primary source of funding for the Black Lung Disability Trust Fund, how much of an impact coal mine bankruptcies have had on the trust fund's solvency compared to other challenges, such as interest on longstanding debt, and lastly, the impact of the Obama administration's failed energy policies and the Biden administration's similarly flawed approach on energy on coal company bankruptcies and on OWCP's resulting obligations.
Sure. In terms of the issues relating to the trust fund debt, as was noted by the ranking member Keller, many of those have been longstanding from the very beginning of the Disability Trust Fund. At the current time, the payment on interest into the trust fund is significant and is problematic in terms of any ability to reduce the trust fund debt. I believe in the last fiscal year, $214 million was required to be borrowed simply to cover the debt, which added to the $6 billion of current debt. In terms of the ability to raise revenues that would be necessary, obviously the sole mechanism that we have at this time is, so that we can make sure that we can protect the interests of the miners is either further borrowing from Treasury or the use of the excise tax.
Mr. Godfrey, the 2021 National Academy of Social Insurance report on workers' compensation benefits, cost, and coverage estimates that for state workers' compensation and longshore workers' compensation paid by private insurers, the total cost of benefits are made up about 50% disability benefits and 50% medical benefits. Currently, the FICA program's cost of $3 billion per year is made up of 67% disability benefits and 33% medical benefits. Why are disability benefits a much larger percentage of benefits under FICA? As Congress continues to examine the FICA program, what can we learn from states and private insurance on strategies to reintegrate individuals into the workplace?
Thanks, that's a great question. One of the major differences that I have seen from being in a state system in Iowa versus the federal system here at OWCP is the ability to settle claims. Because there is no settlement provision within the FICA program, claims are on the periodic rolls until we can establish that individual can go back to work or does have a different type of retained earning capacity. That is a big challenge for the FICA program.
Thank you very much, and thank you, Madam Chair, for yielding time.
Thank you, Representative Fox. I want to recognize now Mr. Takano. Mr. Takano, you recognize 5 minutes.
Thank you, Madam Chair. Mr. Godfrey, your agency's appeal process for self-insurance appears to take so long that a company can largely escape your requirements. For example, DOL asked Warrior Met Coal, which has an estimated $85 million in black lung liabilities, to increase its collateral from close to $20 million to $39 million. But Warrior Met appealed, and now, almost 2 years later, it appears the company still doesn't have to comply. My first question is, would you agree that a company that has posted collateral for less than 25% of its liabilities presents a risk to taxpayers if it is faced with a downturn in the market?
Yes, we agree that the trust fund and taxpayers need to be protected against the consequences of coal mine bankruptcies. That's where we're going to move forward with the appeals, which are currently pending, including the Warrior Met appeal, as well as the other coal companies that were left by the last administration. And then we're also going to be proposing our new regulation, which I think will make it a much more efficient, speedy, and accurate process to make sure that we're getting the correct levels of security.
Well, thank you, Mr. Godfrey. I'm very pleased to hear that. Warrior Met appears to specialize in metallurgical coal that is largely mined and exported. If I understand it, that coal is not subject to the tax that funds the Black Lung Disability Trust Fund. Is that correct?
That is correct.
So if this company shifted liabilities onto the trust fund, for the most part, it would not have contributed to that trust fund.
At least not through the excise tax. That's correct.
Well, I would like to ask, Madam Chair, unanimous consent to insert into the record relevant excerpts of the 10K filings for 2017 through 2020 of Warrior Met Coal.
Order.
Now, based on these documents, Warrior Met Coal has paid out a whopping $1.5 billion in dividends and stock buybacks since 2017 during a period of only $1.4 billion in total book net income and only $312 million in increased company value. It appears that the private equity funds controlling this company are stripping its assets. When will this company actually be required to post the collateral your agency believes it should?
Sure, we are moving in the process of handling those appeals, and I would say that within a 90-day time period would be our aspiration. That was the aspiration of the prior administration when they testified. I do believe a 90-day time frame is likely for holding them accountable.
Well, I certainly hope so. And I know that the chairwoman and this committee will be very interested in making sure that your assessment is correct. What steps should be taken so that Wall Street firms are not able to game the system by socializing the costs of Black lung benefits while privatizing their gains in the events of a bankruptcy?
Sure, I think the best thing that OWCP can do is to move forward with the GAO recommendations and expand upon them. We're committed to strengthening the safety net for workers by making sure that those self-insured coal companies can meet their obligations under the Black Lung Benefits Act. And our role in that is to make sure that they have adequate liabilities. And we're taking the steps necessary by handling those current appeals, which are pending, and then moving forward with the regulations so that we can always meet those goals.
Well, I certainly appreciate your testimony, Ms. Godfrey, and I hope very much that we will see Wall Street firms being prevented from gaming the system. This is really atrocious. We're talking about minors suffering from Black lung, and I am just appalled at the gamesmanship that's been allowed to occur. I yield back, Madam Chair.
Thank you, Mr. Cano. I'm going to recognize now Ms. Representative Miller Meeks. You're recognized for 5 minutes, ma'am.
Thank you, Chairwoman and ranking members as well, and thank you to our panelists. And Mr. Godfrey, thank you as a fellow Iowan. Thank you very much. I'm not a Bulldog, I'm a Hawkeye, but nonetheless, we thank you for your service. And before I begin my questions, I would just like to respond to some comments made by one of my colleagues that implied that the Office of Workers' Compensation should more closely monitor state workers' compensation systems. And I associate myself with comments made by Ranking Member Fox. I think it's important to point out that state workers' compensation systems are already effectively monitored through state oversight, insurance regulation, and research specific to each state. Adding another layer of monitoring is not necessary and could result in unintended consequences for insurance policy holders. State systems are highly effective at addressing the localized concerns of employees and employers, and we should continue to ensure that states, not bureaucrats in Washington, can regulate their systems. And with that, Mr. Godfrey, this November, the United States reached a grim milestone by surpassing 100,000 drug overdose deaths in a 12-month period for the first time in our history. The pandemic has only exacerbated opioid and drug misuse. Meanwhile, the Department of Labor leadership recently reallocated resources from its opioid management to COVID-19 claims adjudication. Do you believe it was an appropriate time to raid FECA's opioid management fund?
First of all, answering your first comment, I'm a Bulldog, but I'm a Hawkeye fan, so so it's good to talk to you. But in terms of the transition was made there during the initial time frame of COVID. I think the reason that that is allowable is because the FICA program and the prior administration as well had done a great job in terms of reducing the dependency on opioids. We had seen the levels of FICA claimants that had been taking opioids for greater than a year go from 9,000 down to 1,500. And as we move on to the PBM, the pharmacy benefits manager, we have very strict guidelines that are going to be put in place, which will make it even more difficult and more stringent to control opioids, leaving them to 7-day prescriptions, after which the physicians will be required to present significant evidence through pharmacy management and physicians and the FICA program to get further opioid prescriptions. So I do think that the program has done a great job.
Yeah, I think that one of the cost of the pandemic and how we've responded to the pandemic, and it is, I addressed this with Dr. Walensky and Dr. Fauci on the subcommittee on the coronavirus task force, is the number of excess deaths. And we now know that the number of excess deaths from how we handled COVID-19 with lockdowns, isolation, banning social gatherings, that has led to excess deaths, which are now in excess of what has happened from COVID-19, if in fact all deaths were COVID-19 and not somebody hospitalized with COVID-19. And in fact, the San Francisco Chronicle had published earlier this year, and then in fact has followed up with data that the deaths from overdose in the 18 to 45-year age group, in contrast to those deaths from COVID, which are in the elderly age group. So these are 18 to 45-year-olds, are twice what they were from COVID. So I think it's extremely important that we recognize that in trying to treat a pandemic, that we're also creating harm to other individuals and individuals in a younger age group. One of the other concerns I had was that earlier this year in Ed and Labor, we had a markup on COVID-19 funds with a presumption of COVID-19 in the workplace for longshoremen. I will readily admit that we do not have any ports in Iowa, and I'm not exactly sure how longshoremen work. But in my mind, longshoremen are not in close contact with other individuals, such as they are in one of our, other facilities or manufacturing facilities. And we recently addressed that individuals that are more isolated in their workplace, i.e. truck drivers, don't have the same degree of risk to other individuals. So can you tell me what's the average work hour of a longshoreman?
Congresswoman, I cannot do that. What I can note, though, is, I do share your understanding that, my first job out of law school was representing IBP. I've driven through Ottumwa many, many times. I know the close proximity they work. I know the hot, steamy environment in which they work. I know that there are many occupations which obviously have considerable exposures that could occur.
So my concern is,
know the work.
I do apologize for interrupting you. I'm so sorry. But my point is that when we make a presumption of COVID-19, when contact tracing, as a former director of public health and talking to my local public health agencies who have done contact tracing, the majority of disease is coming from the community, from outside the workplace, where people spend 8 hours in a workplace, but where there have been mitigation strategies put in place, the vast majority of their time is outside and infections are community acquired. So we're placing an undue burden on employers when in fact we're, as former colleagues said, we're socializing the responsibility for where COVID-19 came to employers and taxpayers. Thank you, and I yield back my time.
Thank you very much. I recognize now Representative Jollival. You recognize 5 minutes.
Thank you, Madam Chair. And I am proud to represent thousands of workers that do keep one of the United States' largest ports running in Seattle. Our current supply chain challenges perfectly capture the critical role of longshore and harbor workers in delivering goods to American consumers, factories, and businesses. And during the pandemic lockdown, these were some of the essential workers that put their lives on the line to keep essentials flowing into the country, displaying remarkable resilience and flexibility. And despite their invaluable contributions, longshore and harbor workers are not afforded the same protection as federal workers and are not covered under state workers' compensation laws. That is an oversight that must be rectified. There are at least 59 COVID-19 cases that have been confirmed at the Port of Seattle since March of 2020, resulting in hundreds of dollars in lost wages and medical expenses for those workers and their families. So, Mr. Godfrey, under the current requirements of the Longshore and Harbor Workers' Compensation Act, what kind of documentation is required to meet the standard to get a COVID-19 related claim approved? And what's the hardest requirement to meet?
Sure, thank you for that question. First, I would point off, I have had the opportunity since becoming director of OWCP to tour ports, and I've seen not only with the ports in terms of the supply chain, but I've also seen ship repair, shipbuilding, and I see the very close quarters and the hazardous exposures that they do have. Obviously, as it relates to the Longshore program, the medical evidence is, it's difficult to establish because of the unknown of where infections can occur. I do know that of the COVID claims that have been filed program-wide that we've been able to determine from our review, less than 10% of those claims have been accepted, whereas under the FICA program and others, the numbers are obviously significantly higher, over 81% within the FICA program.
Well, you're teeing it up perfectly for my next question, because you had described how the American Rescue Plan improved access to workers covered by the Federal Employees Compensation Act by shifting the presumption of COVID-19 claims. But as you say, the OWCP has processed more than 19,000 coronavirus-related claims under FECA since February of 2020 and has 200 pending claims. But meanwhile, of about 1,300, just 7% of COVID-19 claims filed by longshore and harbor workers have been approved. So based on your experience of implementing this policy, what would be some of the impacts of HR 3114 on case approval rates and program administration?
Sure, I think one of the first things to note, we've seen the 22,000 claims that have been filed and the 18,000 claims that have been accepted for COVID-related matters from federal civilian employees under FICA. And we've seen the number that I understand is accurate is 2.1 million federal civilian employees. So the numbers that we're seeing are a very small number of federal workers who actually had claims. And of those claims, many of them actually had no lost time or medical costs at all. So it's difficult for me to make a jump to know exactly how that would correspond with the Longshore program. But what I do see is that the number of workers as a percentage is small that file a COVID claim. And I think the data that we've seen from NCCI, the National Council on Compensation Insurers, also supports that the average cost per claim where there is actually costs to that claim is approximately $8,700.
Thank you. And how do the record keeping and reporting provisions of the bill compare to the typical cost of administering workers' compensation?
I'm not certain of what you're asking in that question. I apologize.
Just essentially wanting to clarify that the costs are modest and they're not more complicated than administering any other workers' compensation program. The primary reporting requirement is just asking for verification that the employer is compliant with the current COVID-19 safety guidelines, correct?
That is correct. Yes.
Great. Well, I think, moving freight, operating equipment, building ships in America's ports and harbors have always been dangerous jobs, and the costs that are incurred by lost wages due to coronavirus illness and quarantine, not to mention the cost of medical care itself, can make or break a family's budget. And so HR 3114 is a common sense bill that extends the same protection that federal employees enjoy to longshore and harbor workers. And I really believe that we must ensure that these essential workers have easy access to the benefits they've earned. Thank you, Madam Chair. I yield back.
And thank you. Is Representative Owens on?
Thank you, Madam Chair. Coal mining has been a vital part of the economy and livelihoods in the state of Utah for 150 years. Many of my state and districts are impacted by the Black Lung program. Mr. Costa, how much do the Western coal operators pay into this fund? And second, how much in benefits are paid out of the fund to employees in the Western operation versus contributions and payout in the Eastern operations? And Mr. Godfrey, if you wouldn't mind, if you have any other additional thoughts you'd like to add to expand, please feel free to do so.
Thank you, Congressman. Unfortunately, I don't know how much the companies in each area have paid into the program. I do know how much has been paid out in the different areas of the country. So in answer to the second part of your question, roughly $145 million has been paid to beneficiaries in the eastern part of the country, east of the Mississippi, primarily in the Appalachia part of the country. And $4 million has been paid in states west of the Mississippi. So there is a very large difference in the amount of benefits going to both sides and the number of beneficiaries, where the beneficiaries are located. Most of the beneficiaries are located in the Appalachia region. Okay, thank you.
Ms. Godfrey, would you like to add anything to that?
I actually do not have data related to those numbers.
Okay, well, thank you. And I'll yield back remainder of my time. Thanks so much. Thank you, Mr.
Thank you. Let's see. I'm trying to see who is
That would be Mr. Good, Madam Chairwoman.
okay, Mr. Good, you're recognized for 5 minutes.
Thank you, Madam Chair, and I'd like to echo the remarks of the Ranking Member Fox a few moments ago about coming into the committee hearing in person. And I'd like to just let everyone know that the committee hearing room is Rayburn 2175. I've not seen anyone from the majority party in the committee hearing room since I got here a year ago, and it's comfortable and it's accommodating, and it'd be much more meaningful for us all to be in person. We're here with our witnesses instead of hiding behind COVID and pretending that we're afraid to come into the hearing room because of that. But instead of discussing that, I'll move to my line of question, or further, I should say, my line of questioning here. I share the concern that's been expressed for our injured workers, but I'm also concerned for all the injured small business owners and their employees who've been hurt over the last year by these disastrous economic and fiscal policies of the Biden administration. Over the last 10, 11 months, we have seen historically high gas prices, grocery prices, and causing massive overall booming inflation from these policies. And that's hurting Americans all across the country. But instead of discussing that, my colleagues in the majority would rather discuss anything else. And that's because Congress is doing what it does best, making the problem worse. We're spending money we don't have and implementing damaging and dangerous policies to advance the radical Biden-Pelosi socialist communist agenda. And the Fed continues to accommodate by printing more money to pay for it. But workers across the country continue to pay more for their essentials, and what's left of their hard-earned savings is being robbed of its value as the federal government continues to devalue the dollar. This is not complicated, but our so-called experts in DC think they can lie their way out of this. However, Americans are not fooled because they can see and feel these rapidly rising prices. But the majority would rather talk about other things, but Americans need answers. So, Mr. Godfrey, does the Biden administration consider inflation to be an issue that's negatively impacting workers' compensation?
Thank you for that question. It is not my understanding that that is an issue that is before OWCP. No.
Do you think that the administration understands that rapidly rising gas, grocery, utility, and other prices are hurting lower income, middle income, and fixed income Americans, and frankly, disproportionately impacting the minority community?
I have no personal knowledge, but I would assume they do, yes.
Yeah, well, I would hope that they do, and which makes it even worse if they do understand that, but yet continue to double down on these policies. You know, other than calling for more spending, which is obviously going to make the problem worse, what does the Biden administration plan to do to try to actually help the problem, to help them fix the problem?
Well, one of the things that I know simply from OWCP is the work on the longshore supply chain issue. What we've seen is since the introduction of the changes to the supply chain, especially at the Los Angeles Long Beach port, We've seen increased workloads. We've seen increased capacity. We've seen the shipping containers being moved following the recommendations of the administration. And what we've also seen is no increased workers' compensation claims because
Well,
of that.
if I may interject, please, I'm glad you brought up the supply chain issue because this administration seems to think that these unconstitutional vaccine mandates that are currently thankfully being blocked by the courts are not only the answer to the inflation, they actually think that if we fire more workers, if we fire more people because they want to protect their own health care, protect their own bodies, protect their own health care decisions, if we fire more people, that and so if we have fewer workers who will produce fewer goods, that'll somehow make prices go down. I need to lend them my high school economics textbook. You know, in your view, Mr. Godfrey, are the Americans who lose their jobs because they want to make their own healthcare decisions, should they be entitled to compensation?
Are you referring to workers' compensation or unemployment compensation?
Just compensation in generally, or should they qualify for that if they're being fired by the federal government, essentially, for wanting to make their own healthcare decisions? I mean, or said differently, do you think that firing millions of workers is going to help the inflation crisis?
That's outside of my purview as director of OWCP.
Yeah. Well, I want to move to another issue affecting workers' compensation and driving up the cost of fuel and utilities, not to mention threatening our national security and increasing overall carbon emissions because it's forcing us to purchase and ship energy from countries who hate us and don't have our emission control standards. This is the impact of the president's war on energy. We knew this was going to happen from the first day when the Biden administration put an end to the Keystone Pipeline. These radical climate policies are decimating American energy, driving up the price of fuel and utilities, and destabilizing the global economy. And unfortunately, I'm out of time for you to answer my questions, but thank you, Madam Chair.
And thank you, gentlemen. Let's see, next we have
That would be Ms. Steele, Madam Chairwoman.
all right, Ms. Steele, the gentlewoman from California, Steele, you're recognized for 5 minutes.
Thank you, Madam Chair. Recently, the United States reached a sad milestone by surpassing 100,000 drug overdose deaths in the last 12 months period for the first time. The largest number of federal employees outside of the capital region is in my home state of California. Any changes to federal workers' drug overdose program with all other programs will be impacted the most in California. The pandemic has only exacerbated opioid and drug misuse. So I want to ask Mr. Godfrey, Department of Labor leaders recently reallocated resources from its opioid management to the COVID-19 claims justification. Do you believe it is appropriate to use the Federal Employees Compensation Act opioid management funds when the opioid overdose epidemic is still an extreme threat?
Thank you for that question. I do believe it is because we've seen significant drops in the number of opioid prescriptions that are used, the number of individuals who have been on opioids for more than 100 days, all of the statistics that we've seen related to opioid usage because of the work of OWCP and the very people that you're speaking of has significantly reduced those numbers far below, I think, what we see in the general population. And I think, you know, where we were needing staff was to deal with the COVID epidemic, with the pandemic. And we've now moved in with the FICA program to a pharmacy benefits management service. And that in and of itself has even greater levels of protection than what were previously being provided. So I'm comfortable that going forward, that it was the right decision to utilize those staff members where they were most needed, because we've seen zero impact on opioid usage amongst FICA employees. In fact, the numbers continue to reduce.
Really, because what you are saying about opioid drug overdose is reduced, but you know what, that's not what we really hear, and that's not what we really see. Especially Orange County has been growing too, and not just Orange County, but California and other states too. So I think kind of like what you're saying is contradicting that, you know what, about the opioid. But let's move on. So what actions has the Office of Workers' Compensation Programs taken to combat opioid and drug misuse?
Sure. And I think just for purposes of clarification, the numbers that I'm speaking about is that population of individuals who have federal workers' compensation claims and who are beneficiaries with accepted claims. I'm not speaking about the overall community outside of the federal workforce or the federal workforce that has had federal work-related injuries. So I think that may be where we're sort of looking at different numbers.
So do you have any of those stats of those federal employees that, how many and which states and, how many, what kind of like percentages of, employees are using through workers' compensation programs or other federal workers drug overdose programs?
I can certainly get the information to you by state, but what I can tell you is that there's less than 300 FICA claimants that have a diagnosed and accepted opioid use disorder related condition at this time. And approximately 9,000 federal FICA claimants that had been taking opioids for over 1 year, with 1,500 of them at levels above 90 dose equivalents. This is the largest reduction from January 2017 because the levels of 17, they were previously 17,000 taking them for longer than 1 year. So that's going from 17,000 down to 9,000. That's been a very, very significant drop. And then in terms of those that take the highest levels of opioids have gone from 4,000 down to only 1,500. So
love to see those numbers. I mean, if federal employees getting much less numbers and it's been decreased, it's very, very good sign, but love to look at those stats and love to have it. So thank you. But is the Biden administration taking the opioid overdose epidemic seriously? Because the last administration made many reforms to the Federal Employees Compensation Act program to combat opioid misuse. So what is currently being done to build on those successes?
I agree. During the past administration from 2017 on, there were significant reductions in opioids, and that should be applauded. What we're doing now is building on what has been that accomplishment, trying to take it farther through the protocols of the PBM. The
Ladies' time is up. Ladies' time is up.
You know what, Madam Chair, I just want to get those stats from Mr. Godfrey, and you know what, maybe I can get these answers in writing. It's going to be really great. Thank you very much for your answer.
And thank you. Okay, Representative Cawthorn, if you're on, you have 5 minutes, sir.
Excellent. Well, Subcommittee Chairwoman Adams, thank you very much. Congresswoman Steele, thank you for your questions to Mr. Godfrey. Those were great. I'll be directing most of my questions to Mr. Costa, but like many Americans, I grew up idolizing Ronald Reagan, a president who believed in America and Americans. He was the great communicator. He'd always turn a phrase in particular, and with me, some of those that are sticking with me is that, when he said government isn't the solution, government is a problem. And the 9 most terrifying words in the English language are, I'm from the government and I'm here to help. The history of American politics is believers in big government, people who believe that the government will come in and fix all our problems. And then those freedom, liberty-minded citizens who send their own candidates to fight against that. Today, we are once again noting the actions of the governments that are set against the people, particularly in the case of the war on coal. Mr. Costa, the 2020 GAO report notes that from 2014 to 2016, U.S. coal production decreased from 1 billion tons, which is an incredible number, to only 728 million tons. What impact did this decreased production have on the Black Lung Disability Trust?
Yes, Congressman. So the decrease in coal production has definitely had a strong impact on the amount of revenue that the Black Lung Trust Fund has been collecting as a result. It's a huge impact on it. In addition, to the decrease in the amount of coal, we've also started to see a rise in the number of coal miners, who are contracting black lung. So there's a good likelihood that we'll see an increase in liability. At the same time, with more bankruptcies going on, there will be less production, so there should be less revenue coming in as well.
I mean, that's absolutely correct. I think, it was there to take care of all the shortfalls for the funding, and it's really a true problem. And really, during the Obama administration, Democrats repeatedly asserted that their regulations on coal-fired power plants would not jeopardize the industry. I mean, all of us at this time realized that was asinine and not true, but we now know that to be untrue as a fact. Democrats' war on coal has led to the bankruptcy of dozens of operators, jeopardizing the economies of the Rust Belt states and leading to increased liabilities for the Black Lung Disability Trust Fund. Now, having said all that, I want to be clear on this. Does declining coal production contribute to the trust fund's financial challenges? And going even further, it seems likely that the effect of the government interference was twofold in the negative, both reducing the amount of coal available and decreasing the funds available for the trust fund. Is that something that you would agree with, Mr. Costa?
Yes, declining coal production has impacted the trust fund's revenue. In addition, though, there was a year where the coal tax dropped as well, and that also had a rather large impact. We're estimating that if the coal tax drops again in January, that the trust fund will have about $15 billion of debt by 2050, and that's accounting for additional potential bankruptcies as well as drops in revenue.
Well, let me ask you one more question regarding the bankruptcies. I mean, how many of these operators have we lost with since the 2014 time when they really declared this war on coal?
We estimated that we believe there have been at least 5 additional bankruptcies since we reported on the bankruptcies from 2014 to 2016. Both of self-insured companies, that is, and at least 3 of those companies have transferred liability that they had not properly set up collateral for to the trust fund.
Well, I mean, that's terrible. I can't imagine how many lives have been just completely disrupted, people's financial plans destroyed by these democratic policies, which are so anti-American, anti-human, anti-energy. And really just thanks to the failed energy policies of this administration, it seems that the Black Lung Disability Fund and the American people will be better served by more coal production. Now, thankfully, thanks to an increase in demand, we recognize that there's an uptick in production, but can we really count on this uptick to continue going when we have a president who actually disdains the industry?
I don't know that I'm qualified to answer that question, sir. We looked at the trust funds. Yeah,
on behalf of the American people, I think we all realize that this industry will be severely limited and attacked by this administration. It's very, very sad. And I hope the Democrats can really come to their mind. We can all come together and try and fix this so we don't have more bankruptcies coming, even since the 5 that we had since you did your last study. It's really sad. So many people lose their livelihood. So many people they take pride in working with their hands and take pride in providing for this country. And it creates a spiritual poverty when people also are incapable of actually being able to serve this country by serving our energy needs. So, Mr. Costa, thank you very much. Chairwoman Alma, I will now yield back. Thank you very much to a fellow North Carolinian.
Thank you, Mr. Cawthorn. I think all members, committee members have spoken. I did want to respond before I provide time for Mr. Courtney and Mr. Mervin. In terms of responding to the comment that was made earlier about the committee, we did, as a courtesy, wait about 15 minutes, but this committee was announced that it would be held at 2 o'clock, regardless of whether there was was votes or not. But also, if you look at House Rule 11, Clause 2, committee rule maintains that a quorum for the purpose of taking testimony and receiving evidence is any 2 members. We had a majority. I just wanted to clear that up for the record. I want to recognize now Mr. Courtney. You are recognized for 5 minutes, sir.
Thank you, Madam Chairwoman, and thank you for your courtesy to allow me to join the subcommittee today. And again, I just have a couple quick questions. Mr. Godfrey, recently I introduced bipartisan legislation with my good friend, Mr. Wahlberg, the Improving Access to Workers' Compensation for Injured Federal Workers Act, HR 6087. which will update the Federal Employee Compensation Act program to allow injured workers to seek care from nurse practitioners and physician assistants in addition to physicians. In 1974, when Congress amended the Federal Workers' Compensation Program, Congress specifically allowed workers to seek treatment from their personal physician in order to provide employees free choice of who provides their care. However, these changes only allow for a physician to provide their treatment and sign off on claims. In the interim, as I think we all know, physician assistants and nurse practitioners have become a major component of the healthcare system and supplement the physician workforce and serve as primary care providers and specialists across the country, especially in rural and underserved areas. Our legislation would align the federal law with the reality that nurse practitioners and physician assistants are the first line providers for many federal workers, and they should be incorporated into the program and would help address barriers to accessing the compensation workers are eligible for, in part because it can be difficult sometimes to find a physician participating in the program. So Mr. Godfrey, can you describe the challenges that workers currently face in having their claims approved as it relates to finding a physician, and why is it difficult for them to find a physician willing to participate in the program? And lastly, from your perspective, would allowing physician assistants and nurse practitioners take some of these cases help improve access to compensation for eligible workers?
Thank you for that question. There's several things that I think are responsive to your question. First, I think the issues related to a federal system with physicians located in one state, sometimes they have difficulty with the billing practices. And what we're looking to do is move forward with a medical provider network, which would allow us to have a greater ability to access and work with physicians to make sure that it's easier for them to work with us, so that when they provide services, they can be timely paid for the services that they do provide. So I think that will be one instance. Obviously, you touched on the other issue, rural America. Oftentimes, I know coming from Iowa, it's difficult to have a doctor in a specific town. It may be that a nurse practitioner or a physician assistant is the only individual who can provide the immediate treatment that you need or the ongoing care that is required following a workplace injury. I would note that my prior position was as the chief judge of the Employees Compensation Appeals Board, and it is accepted within the FICA program for nurse practitioners and physician assistants to provide care. I think the distinction that we have seen is that based upon existing case law or regulation, that a physician is given greater weight in terms of an opinion than a physician assistant or a nurse practitioner. So I think that is where we need to be careful in terms of moving forward. But I agree with you, the more that we can do through telehealth, the more we can do to utilize nurse practitioners and physician assistants will make it much easier for the claimant population to get the care that they need.
Great. Well, thank you. And as I said, this is a bill which, in my opinion, is just sort of updating the law and modernizing the law. And it basically allows the law to be aligned with the reality that's out there. And I think all of us can personally attest to the fact that the role that this level of practice is now well established in the U.S. And we just want to make sure, again, that the federal employee compensation system reflects that with this update. So thank you for your testimony, and thank you, Madam Chairwoman, for letting me participate this afternoon.
And thank you, Representative Courtney. I'm going to recognize Representative Stevens, and then we'll get to Mr. Mervin. Representative Stevens?
Yeah, I'm here, Madam Chair, and thank you so much for having today's important hearing. This is one of the major reasons I have been just compelled to serve on this committee and do the work of this subcommittee, particularly on workforce protections. Today's topic regarding the safety net and the conversation that we've had around workers' comp and some of the threats, this is very visceral to us in Michigan. It has come up to me from constituents time and time again. And as we hone in, I'd like to center us on opioid abuse again, because we have just seen an incredible toll of fatalities, of overdoses. We have injury claims being made each and every year. And recently, as of 2018, approximately 27,000 people in the federal workers' compensation program who, are chronic opioid users. So, Mr. Godfrey, the department has taken reforms for prescribing opioids to treat pain, but it's certainly still excessively permissive policies in the past that have kind of resulted in tens of thousands of injured workers becoming addicted. And I'd be curious for you to just describe how DOL is managing this today, and what we need to know about some corrective steps that you've put into place.
Yes, thank you for that question. I agree, and it's been a national tragedy. Outside of the workers' compensation system, again, we see lives disrupted unexpectedly by simply being prescribed an opioid and addiction following from that. The Department of Labor has recognized, going back before even 2016, as this tragedy unfurled itself. And the actions that have been taken since that time, as I've talked about, with the statistics that I shared with Representative Steele and will provide in greater detail, show that there has been a significant decrease. But it does require continued monitoring. And we've made sure that, first off, limiting the number of authorizations and the dosages of those authorizations, going back to the fall of 2019 with a bulletin. But now moving into the PBM, the Pharmacy Benefits Management Service, we do have, I believe, even greater protections in place. Again, this impacts people within the workers' compensation area, and that's where we can make an impact. But obviously, this is just a horrible tragedy that is affecting people both outside of the workers' compensation system and in it.
Right.
But any way that we can learn from what we've done in DOL to be successful, I think should be shared.
Yeah, it could be shared, and certainly, not bearing the full responsibility. And I really appreciate your answer and your work in general. One other question for you, separate to what we were talking about on, on opioids, is how are you at all, and this is out of curiosity for the scope of work that you are undertaking as a director of the office in the Department of Labor, but how are you working with states and states, programs? Because I can just imagine that getting really dizzying and really complicated, and I'm wondering if I can help you.
Sure. I think the way that I can answer that best is to note that as a commissioner in the state of Iowa, I was involved in national and international organizations relating to state workers' compensation systems and jurisdictions. And I built relationships, namely through the International Association of Industrial Accident Boards and Commissions. And that's an organization which all the states and several jurisdictions from Canada, Australia, Germany take part in. Although from OWCP, working with states really does not exist to a large extent. Working through organizations like that, where we can build relationships, where we can share information, our best practices and our data can be shared with the states. For instance, the opioid work that we've done. I know many states have made great progress through their work comp systems with opioids, but the things that we can share with them, that's been very, very helpful.
Thank you for that. And Madam Chair, I yield back.
And thank you, Representative Stevens. Thank you very much. I'm going to recognize Mr. Mervin. Now you have 5 minutes, sir.
I'm going with that.
Okay.
Thank you, Chairwoman. I just want to take a moment and thank Chair Adams and the committee staff for holding this important hearing today to provide oversight of the OWCP and for including in this discussion legislation I have introduced, the Longshore and Harbor Workers COVID-19 Compensation Act. Throughout the pandemic, maritime workers have performed essential work. They have toiled to keep our ports operating, loading and uploading ships, building and repairing vessels, and oftentimes working in close quarters as they do so. As has been discussed in this hearing today, workers deserve adequate recourse when they suffer workplace injury or illness. However, hundreds of longshore and harbor workers have contracted COVID-19, a deadly illness, have lost out on wages due to a mandatory quarantine requirements, and have incurred medical expenses due to illness. But those workers have been unable to access workers' compensation afforded under the Longshore and Harbor Workers' Compensation Act. Unless they overcome a burdensome process to prove they were infected at work. To remedy this issue, my bill will establish a conclusive presumption that longshore and harbor workers who have tested positive for COVID-19 contracted the virus at work, making them eligible for workers' comp under the LHWCA. This measure would ensure that longshore and harbor workers enjoy the same presumption that essential workers in several states and frontline federal workers now benefit from and serve to protect the health, safety, and livelihood of our maritime workers. I thank the chairwoman again for this time and her leadership on this legislation. And I again thank her for the opportunity to discuss this important legislation. And I thank you and I yield back.
Thank you very much, Mr. Mervin. Have all of the members had an opportunity to speak? We've had some people to come in and out. Okay, great. Pursuant to committee practice, materials for submission for the hearing record must be submitted to the committee clerk within 14 days following the last day of the hearing. So by the close of business on December 16th, preferably in Microsoft Word format. Only a member of the subcommittee or an invited witness may submit materials for inclusion in the hearing record, and the materials must address the subject matter of the hearing. Please submit materials to the committee clerk electronically by emailing submissions to edandlabor.dot.hearing@mail.house.gov. Again, I do want to thank the witnesses for their participation today, and I thank all the members of the subcommittee for their attendance. The members may have some additional questions for the witnesses, and so we ask that you please respond to those questions in writing. The hearing record will be open for 14 days in order to receive those responses. I do want to remind my colleagues that pursuant to committee practice, witness questions for the hearing record must be submitted to the majority committee staff or committee clerk within 7 days. The questions submitted must address the subject matter of the hearing. I want to recognize the distinguished ranking member for a closing statement. Ms. Keller. The ranking member present.
Yes, I am, Madam Chair.
Okay.
I would ask unanimous consent to enter into the record a letter from more than 90 national and state trade associations and businesses, including the National Federation of Independent Business, opposing the authorization of funding for DOL to monitor state workers' compensation programs.
Yes, sir. So recorded.
Thank you. And now may I do my closing?
Yes, sir, you may.
All right.
Go right ahead.
Thank you. I'd like to thank the witnesses for their testimony. Today, we discussed a wide variety of federal workers' compensation programs, in addition to legislation which purports to solve shortcomings in many of them. Unfortunately, many of these proposals discussed today only add additional layers of expense to already bloated and mismanaged federal programs. For instance, the Black Lung Disability Trust Fund, or the BLDTF, has been in debt since it was created over 40 years ago. Many of the trust fund's problems stem from the Department of Labor's decades-long failure to provide proper oversight or enforcement, in addition to its interest accumulation on its debt. The Trump administration made great strides to correct flaws in the Black Lung Benefits Program and to revamp the self-insurance process for coal mine operators. But the Biden administration chose to weaken the Black Lung Trust Fund by withdrawing these common sense reforms. Additionally, committee Democrats introduced a partisan bill just yesterday which allegedly addresses the failings of the Black Lung Benefits Program. It is just irresponsible and absurd to have a legislative hearing on a bill released only a day before with no stakeholders present to testify and provide feedback. With regard to the FICA program, however, bipartisan agreement should be possible. In the 112th Congress, this committee and the House of Representatives took steps to reform FICA by passing bipartisan legislation. I look forward to working with my Democrat colleagues with the hope that we can repeat this success in the 117th Congress. Rather than implement radical proposals such as improperly monitoring state workers' compensation programs, I urge the Office of Workers' Compensation Programs, OWCP, to focus on reforming the programs it currently oversees by immediately addressing recommendations made by the Government Accountability Office and the Office of Inspector General. And rather than consider partisan and radical legislation, I hope this committee can return to bipartisan cooperation to ensure these programs truly help injured workers, are efficient and effective, and make good use of taxpayer dollars. Again, I thank the witnesses for participating today, and I yield back.
Thank you, Mr. Keller. We appreciate your comments. I want to now recognize myself for the purpose of making my closing statement. But before I do that, because we've heard at least 3 times today during this hearing about the meeting and how it was conducted and when, I just want to remind the members that we, pursuant to the rules and regulations of the House, and the Speaker's extension of the covered period, and that has to do with COVID, and hopefully things won't get worse. The hearing was noticed, it was called to order, and it was noted as a completely remote hearing, which certainly is the prerogative of the chair. And so we're going to continue to conduct the meeting in accordance with all of the rules that we have. So I just want to remind the members of that. And let me just say to our panelists, thank you for your time. Thank you to the witnesses for your testimony. We learned a lot today about the new initiatives being advanced by the Department of Labor, including the reinstitution of the monitoring and reporting on state workers' compensation programs. Greater awareness of these initiatives is needed because many state workers' compensation programs have been pared back as part of a race to the bottom as states compete with each other to reduce employer costs. The implications for the federal budget are clear, which is why there is a role for the federal government. When states have, at the bequest of corporate interests, cut back benefits for workers with disabilities, it's the injured workers and the taxpayers instead of employers who are forced to foot the bill for serious workplace injuries. Without income, workers with disabilities must then turn to Social Security disability insurance and Medicaid or Medicare for medical costs. The Department of Labor is commended for addressing these issues, and we're hopeful that the 5 years of adding funding for this office included in the Build Back Better Act, when enacted, will ensure that this needed oversight of state programs can move forward on a long-term basis. Today, we also learned that the Office of Workers' Compensation Programs has not implemented the necessary changes to protect taxpayers from self-insured cold operators who fail to provide adequate collateral to cover the cost of Black lung benefits if they file for bankruptcy. In a hearing on this subject just 2 years ago, GAO flagged what needed to be done to fix the problem. We need a firm date by when OWCP will provide a solution, a firm date. The system has been gamed for too long, and at least $1 billion in Black lung disabilities has been transferred from coal operators and Wall Street investors to the trust fund, driving it even further into debt. The red ink today is over $6 billion. DOL also needs to develop a long-term strategy to shore up the solvency of the trust fund, so there will be no question that the resources are there for minors and their survivors to cover Black lung claims. The Black lung excise tax rate will drop by 55% at the end of December unless Congress extends it. Fortunately, a short-term extension is in the Build Back Better Act, covering through 2025, and we are awaiting Senate action. That excise tax alone is not enough, however. A long-term strategy is needed because coal production has declined and will continue to do so. We should not be in a situation where the federal government is left facing the consequences of the cost of a lethal occupational disease caused by operators who fail to adequately protect their miners. And finally, we learned that there are opportunities to improve the federal workers' compensation programs. And I hope we can move forward to pass legislative solutions that modernize federal workers' compensation programs. Again, I want to thank you, Mr. Carbajal, Mr. Godfrey, Mr. Costa, for joining us today. If there is no further business, without objection, the subcommittee stands adjourned. Thank you.